Hi there, my name is Johnny. I am the Communications and External Affairs Manager here at PHIN. I'm just doing this quick video today to update on our work with NHS Digital on the ADAPT programme. For those of you who aren't aware, we've launched a consultation today on the programme and we'd really like to encourage as many as possible of you to respond to that consultation. So hopefully a number of you are aware. If not, very quickly, the ADAPT programme is a joint initiative between NHS Digital and PHIN. It also brings on board NHS Improvement, NHS England, the Care Quality Commission and Department of Health and Social Care. And it brings together all of those groups with the aim of making sure that the data that's collected on NHS funded activity within the UK, which is collected by NHS Digital, and data collected on privately funded acute healthcare, admitted acute healthcare by the Private Healthcare Information Network. That data is aligned as far as possible, that it uses the same standards and definitions, and that it can be held within the same place, and so they're creating a single source of data reporting for acute admitted healthcare in England. Now we think that's a really important endeavour to be working towards. Having that single source of information allows providers, care planners, regulators, researchers a complete national picture of healthcare in England, where private healthcare at the moment, around 95% of patients who use private healthcare in the UK are NHS eligible patients and use the NHS for the majority of their care throughout their lives. Actually, it's really important to get that national picture to see how patients interact through both systems, use both sectors, and to understand things around the safety element and the quality element around service delivery and the experience of patients as they experience care provided across the two sectors. In a more practical sense as well, we're also aware that where we collect at the Private Healthcare Information Network data that's very similar and largely aligned to data that's collected by NHS Digital, we want to make sure that they are exactly the same, but also if we can consolidate the reporting flows so that all of the data goes through one system, that then reduces the administrative burden on hospitals. So the consultation that's open today looks to address those issues. There are two key things that we're looking at in practical terms. The first one is that the private episode data that PHIN collects in our admitted patient care data set will be transferred over to NHS Digital to have a look and make sure that there is full alignment in the standards and definitions, and that we actually create that single source of reported data in England, and that's then can be made available to researchers, care planners, regulators and so on, for the purpose of having a look at safety and quality and for improving services for patients. The other thing that we're looking at, as I mentioned before, is reducing the administrative burden. So we're trialling with NHS Digital, can independent hospitals and NHS private patient units submit their privately funded activity all through NHS Digital, and for that data then to flow onwards to PHIN, therefore allowing us to publish the information we're required to publish under the CMA order. And obviously that then, if we can make that work, obviously that's going to be a pilot. If that's successful, then we can look at the future at turning off the reporting tap directly to PHIN, so there's only one reporting stream, which hopefully then reduces the administrative burden and creates that single source of truth when it comes to activity. So that's what we're looking at today, that's what we're consulting on. If you want to have a look at the consultation, that will be available in a link below this video. We'd really encourage as many of you to respond as possible. We think this is a really positive step forward for both the private sector, but also in terms of data reporting in healthcare more generally. But for it to work and for it to be positive and effective, it has to work for hospitals and it has to work for consultants. So we really do want to hear your voice and your opinions on that. So if you want to contact the team, if you've got any questions, you can contact me at info@phin.org.uk or respond to the consultation. Many thanks.